In this presentation, we will see about Crouzon syndrome or craniofacial dysostosis. So before we go into that, we need to know a few commonly used terms. So we all know that the cranial skull is made up of 6 separate bones. We have the frontal bone, pair of parietal bone, occipital bone, and a pair of temporal bones. These bones are held together by elastic tissue, which is called as suture. So suture is a site where two bones, two membranous bones are opposing each other. They are arranged in this pattern to allow the normal brain growth to happen. So if these membranous bones are fused, then the brain growth will be poor and the intracranial pressure will increase. So this type of fusion occurs in a condition which we call as synostosis. So synostosis is the fusion of two bones at the site of sutures, or premature obliteration of sutures. We call it as synostosis. Sutures, we need to know their names so that it will be easy when we discuss. So between the frontal bones, we have the metopic suture. Then between the frontal and the parietal bone, we have the coronal suture. And the sagittal suture is present between the two parietal bones. Then we have the lambdoid suture present between the parietal bone and the occipital bone. There's another term called as dysostosis, which means the abnormal development of individual bones, which can be isolated or combined. So we'll see about craniofacial synostosis syndromes. These are a group of syndromes in which there is a premature fusion of one or more cranial sutures resulting in abnormal head shape. So if the sagittal suture is prematurely fused, then we call it as scapucephaly. If the bicoronal sutures, the coronal sutures present in both the sides are fused, then the skull will appear broad, which we call it as brachycephaly. Then plagio meaning sideways. So if one side coronal suture is fused, then we call it as plagiocephaly. If the coronal suture along with any one of the suture, either lambdoid or sagittal is fused, then we call it as oxycephaly. Then there is a term called as trigonocephaly. Here there is premature fusion of metopic suture. So usually the metopic suture is present between the frontal bone. So if it's prematurely obliterated, then the skull is trigone in shape. So we call it as trigonocephaly. So under this group of syndrome, we commonly what we see is Crouzon syndrome, Pfeiffer syndrome, and Eppert syndrome. So all these are usually autosomal dominantly inherited syndromes. So now we'll see only about Crouzon syndrome, or which is called as craniofacial dysostosis. So the word itself says dysostosis, meaning there is abnormal development of bone, especially the craniofacial bone. So it was described by Octave Crouzon in 1912, and hence it's called as Crouzon syndrome. So it's a genetic disease which is autosomal dominantly inherited. So here the mutation is present in fibroblast growth factor receptor 2 gene, which is present on the chromosome 10. So normally the FGFR2, this receptor, FGFR receptor, this is present on the cell membrane of cells like osteoblast. So we know that the osteoblast, these are all the bone forming cells. So this normal stimulation of FGFR by the fibroblast growth factor results in differentiation of the osteoblast. So whenever there is a mutation in this FGFR, then there will be accelerated osteoblastic differentiation resulting in premature obliteration of the sutures. So most commonly the coronal and the sagittal sutures are prematurely fused. And this type of genetic disease, it has complete penetrance but variable expressivity, meaning that the severity of the disease differs between individuals. So some might have mild disease, but some may have a moderate or severe disease. Then most of the patients will have positive family history. So these are all the most commonly observed clinical features. So the skull deformities may be present. So as we discussed earlier, based on the type of suture that is going to be fused, the skull may be brachycephalic or scapucephalic or trigonocephalic. Sometimes when the coronal, sagittal as well as the lambdoid sutures are fused, then we call it as cloverleaf skull. So this is how a clover leaf will look like. And when similarly, when the skull is trilobate, we call it as clover leaf, clover leaf skull, and it's also called as Klebat shadal deformity. And the patients with the syndrome may also have proptosis, that is the protrusion of the eyes. This is because of the shallow orbit. Patients may also have facial anomalies, most commonly the mid-face hypoplasia or the maxillary hypoplasia. And the eyes may be wide set, which we call it as hypertelorism. And because of this, the face will appear like a frog, and it's called as frog-like face. And the nose may be prominent, and which we call it as parrot-beak nose. Other features can be seen, that is, most of them will have respiratory difficulty. And middle ear disorders can lead to hearing impairment. And patients may also have mental retardation. Crouzon syndrome is often associated with a condition called as acanthosis nigricans, where there is abnormal velvety hyperpigmentation of the skin. And oral manifestations, the patients will have Angel's class 3 malocclusion. Because of the maxillary hypoplasia, the mandible appears to be protruded, and the palate is high arched. Some of the patients may even have cleft lip or cleft palate. Then there's something called as midline maxillary pseudocleft. So these patients do not actually have a cleft, but because of the high arched palate and also the expansion of the alveolar process, it is called as pseudocleft, cleft-like midline maxillary pseudocleft. So if we take a skull radiograph, we can see that the mandible appears prognathic and the maxilla is underdeveloped or hypoplastic. Then the orbit is shallow, and also the hypophyseal cavity, it is enlarged. Then there are multiple radiolucency present in the skull. This we call it as beaten copper appearance. So this is how a beaten copper appears. Similarly, here in these patients, because of the increased intracranial pressure, the gyri, the markings of the gyri are very prominent in the skull, leading to beaten copper appearance. And there are similar other syndromes which we saw, that is Appert and Pfeiffer, which have features similar to that of Crouzon. That is, all these three are autosomal dominantly inherited, and maxillary hypoplasia is present, class 3 malocclusion and oculoproptosis is present in all these three syndromes. But there are some differences. That is, in Appert syndrome, the patients will have syndactyly of the hands and feet. That is, you can see here, the webbed, the hands, the fingers appears to be webbed. And the patients with Appert syndrome may also have cleft palate and partial anodontia, or the absence of teeth. Anodontia means absence of teeth. And patients with Pfeiffer, they have broad great toes, so you can easily appreciate here. And also the thumbs are broad. Here also syndactyly of hands and feet is common. Then we can have supernumerary teeth in this syndrome. So this is a picture of a patient with Appert syndrome, and this is a picture of patient with the Crouzon syndrome. So we can easily appreciate that the patients with Appert syndrome have more asymmetric face, and the clinical severity is also more in Appert. So the treatment, mainly the sutures which are prematurely fused are to be released within the age of 1 year, and facial reconstruction has to be done to correct the ocular deformity. Then orthognathic surgery can be done to advance the midface and also to correct the maxillary hypoplasia. The prognosis is better if the treatment is started earlier, that is before 1 year of age. If the patient is treated, then the outcome has been shown to be better. Thank you.